to start, just start.
Okay. Good afternoon, Jack. Thank you for helping us out with the observed case examination practice today. Today, we'll be asking you to see a patient and take a fulsome history over a 20-minute period. The history needs to include detail about the history of the presenting complaint, but also in the framework of the complete history. That's followed by a 10-minute examination focused on a relevant system. If you're unsure, then we're happy to give you guidance. After that, we'll give you 5 minutes to get your thoughts together and produce a summation. And if you can provide a diagnosis, if it's a diagnostic problem, along with the differential, or a problem list if you think it's more of a management problem at the end of that summation. The few tips for the assessment, and so when you are taking the history from the patient, don't forget to include any relevant details after the time of admission. So don't stop the history from the time they present to the emergency department, for example, but they may well have had relevant history during their time in hospital. You are allowed to look at the medication chart and the observation chart, but you are not allowed to look at the patient notes. Do you have any questions at all?
No, it's pretty good.
Terrific. Let's go.
Okay.
Hello, is this William I'm speaking to?
Yeah, hi.
Pleasure to meet you, William. My name's Jack. I'm a second year medical student at UWA. I've been asked to come and talk to you today and see what brings you into the hospital. I haven't looked at your notes, so I don't know anything about you at the moment. I'd really like to ask you some questions to figure that out, if that's okay with you.
Yeah.
And just whilst I'm doing this, so I don't forget anything, is it alright if I write down some notes?
Yeah, that's
Excellent. So, William, can I just ask what your name and age is, please? Sorry, so it was William James?
James, yeah.
And it was 41.
14/11/59 is my birthday. So I'm 62 this year.
62. Thank you, William. So, William, can I ask what brought you into the hospital?
I've had diarrhoea for about 13 days and got really dehydrated.
Okay. Can you tell me more about that?
Well, I was looking after my granddaughter stayed over, I think 2 weeks ago. Well, it was 2 weeks ago, and she's 3, and she started vomiting that night, which I think she got it from daycare. And then my wife got sick on the Thursday, and then I got sick on the Friday. So my wife got better, and I just kept
getting worse.
Yeah,
Okay.
didn't get any better.
And how long was your wife sick for?
24 hours.
24 hours, okay. And did you have any other symptoms apart from the diarrhoea?
Every now and then I'd have some vomiting and I just felt really nauseous. And then I had some bad sort of dizziness and faintness on Friday when I got dehydrated, and I had to go to Joondalup, and they gave me some fluids, IV fluids as well.
Okay. And that's, you said on the Friday, so that would have been about 10 days after?
Yeah, it was the sort of 8 days after
8 days.
from initially when I went up to Joondalup.
Okay. And can I ask, did you have any pain associated with the diarrhoea?
No, I just had a lot of gurgling and sort of bowel sort of rumblings and things like that periodically, but no pain or anything like that.
Okay.
I just got a bit tight just because of the vomiting.
Yeah, I understand.
It's like doing crunches all the time.
Oh, yeah. And can I ask, when you say diarrhoea, how many times a day would you go to the toilet?
In the morning when I got up, it might be like 4 times in like half an hour, and then it might be 4 or 5 times during the rest of the day. Sometimes a bit less.
Okay.
Yeah.
And did you notice it was worse in the morning? Did it ever wake you up at night?
Yeah, I'd be up during the night going. So some nights I might be up 3 times during the night.
Okay. And it would wake you up from your sleep?
Yeah.
Okay.
And I'll just have to dive off to the toilet.
That doesn't sound very good. I'm sorry to hear that. And can I ask, at any time did you see there was any blood in the stool?
No, there never was.
Was there a foul smell
Yeah.
associated with that?
Yeah. Just,
And with that foul smell, did you notice there was water?
Yeah, it was pretty watery,
Pretty watery.
mostly.
Okay. And was there any mucus in the stool? Can you tell?
Not that I could tell,
I
no.
can tell. Okay. Now, I just want to ask about some other areas, top to toe, just to make sure that you're missing out the symptoms that you had. So you felt dizzy and dehydrated. Was that when you would stand up?
Yeah, pretty much. If I stood up too quickly, I would then get really wobbly and have to sit down. So even if I took, a little bit of time to get up, it'd still be noticeable when I walked around that I'd be really quite dizzy.
Okay.
But that was when it got worse on the Friday.
Mm-hmm.
It hasn't been like that since.
Okay.
Although probably coming in yesterday, it started to be like that, but not as bad.
Okay. And then, did you have a fever at any time?
No, never had any fever.
Did you notice a loss of appetite during the time?
Yeah, just because I was nauseous all the time. So I wasn't really eating much, and if I did eat too much, then I'd get really nauseous. That usually meant that I might end up sort of vomiting that night or something. Or if I ate too much, it'd just sit in my stomach sort of all night until the morning.
Okay. And did you notice at any time with the vomiting, was there any blood in the vomit?
No, it was just straight up food, yeah.
And was it, I guess, when you said when you ate more and it caused you to vomit, did you feel your other symptoms getting worse after food?
I just get bloated and bilious and it would just sit there.
Okay.
Really wouldn't shift for a long time. So,
Okay.
and then I didn't, couldn't eat anything after that. If I had light things or something like that, that was easier. Like just a bit of toast and a cup of tea in the morning or something like that, or yogurt.
Okay. And just one more question on that. Did you, at any times, abstain from eating?
No, I would eat if I was hungry,
Okay.
but I just didn't feel hungry.
Yeah.
So I might go, I might have something in the morning and then not end up really having anything at lunch
Okay.
until sort of maybe later on in the afternoon.
And did you notice in that time when you weren't eating the diarrhea at all?
No,
No.
it didn't change anything.
Okay.
All that happened is if I was drinking water, it would pretty much go straight through me.
Okay. And then, just in terms of the fainting, just want to confirm, did you ever lose consciousness from fainting?
No, I never sort of to the point where I sort of lost consciousness. I just got sort of really wobbly walking. I had to just sit down.
Okay, and that would make it better.
Well, yeah.
Thank you for that. Now, I just want to ask some more questions about your general well-being, and I guess your past medical history
Yeah.
of health. Have you ever been to hospital before?
Yeah.
Yeah.
The last time was August 2019.
Okay.
Because I copped a virus and it knocked my kidney function down.
Okay. And has that recovered? Or
Yeah, it was just a virus,
Yeah.
and once I came in and everything, my levels all went back to normal again, so I've never had that again.
Okay. So that's completely recovered. You haven't had to go into medication or anything?
I'm on medication, so had a kidney transplant in February 2018.
Okay. So you had a kidney transplant. Have you had any other surgeries?
No, I had surgery on my hand, had my hand reconstructed. I got smashed up and I'm going hockey.
Hockey?
Yeah.
Oh, okay.
So that's the only surgery, really, the main ones I've had.
Okay. And how long ago was that?
5 years ago. So yeah, 2016.
And did they put plates in there?
Yeah, I had it wired up. I had 5 wires in there.
Okay.
But that's fine. I went back to hockey and things like that, so I don't have any mobility problems with it or any arthritis or anything.
That's good. Now, I just need to ask about, have you ever been diagnosed with any conditions, like diseases of any kind?
I've got sleep apnea,
Sleep apnea.
and that was from 2004. I was diagnosed with a machine.
Anything else?
No, I've been pretty right other than that.
That's good. Now, I just want to look into your medications. You said you're on medication for your kidney transplant.
Yeah.
Do you know what those are?
Yeah.
Yeah. Could you be able to tell me that?
I'm on tacrolimus, 4 milligrams in the morning.
Yes.
I'm on Myfortic, 720 milligrams twice a day.
Sorry, were you going to say that?
Myfortic. I'm on prednisolone, 5 milligrams in the morning. I'm on Xanadic, that's for blood pressure, that's 10 milligrams in the morning. I'm on ProGout 300 in the morning. I'm on Cannabis 20 milligrams at night time.
Do you know what that one's for?
Blood pressure. And I'm on 1,000 units of vitamin D at night time. I'm on Lipitor 10 milligrams at night. I think that's it.
That's it. Do you use any over-the-counter medication?
No, I take magnesium probably every second night because I do get a bit of problems with cramps and things during the night.
Okay. That only occurs at night, cramps?
Yeah.
And do you have you ever used any non-prescribed drugs for prescribed by people? Have you taken any drugs that weren't prescribed for you?
No, I'm only taking what's prescribed for me.
Do you have any allergies?
No.
Have you been upset with screening tests, such as the physical blood test that comes in the mail?
Yeah, we did our bowel cancer about 3-4 months ago, and that came back clear.
And have you been vaccinated?
Yeah, I had them. I had my Hep B about a month ago, and I did diphtheria, tetanus, and whooping cough. Probably a month and a half ago.
Now, this is a couple of extra questions I have to ask today, patient, so I'm not targeted at you.
Yeah.
Have you do you drink alcohol?
Yeah, I have probably a couple of glasses with my dinner on the weekend,
Okay,
but
so
nothing during the week.
that would be wine?
Yeah.
So it could be 2 to 3 glasses in
Yeah, probably 2 glasses.
2 glasses on the weekend. Do you smoke?
No.
Have you ever smoked?
I think when I was about 18, I did it for about 3 months, and
3 months?
that was about it.
Okay.
So no, I haven't smoked, but I just did adolescent smoking thing.
Okay. I know it was only for a short time, but how many would you smoke in that time?
Well, I wouldn't have, not much. I think I just sort of joined in with the others.
Just social, sort of. Okay. And have you ever used any other drugs?
Yeah.
Recreational drugs?
Cannabis, but probably not much. It was just sort of socially. Probably I haven't since I had the transplant.
Okay.
So it mucks up with tacrolimus.
Okay. And when you say socially, would that be on a weekly basis?
Probably not. It might only be every. Depends. It might only be every couple of weeks or something like that. So it wasn't anything regular.
Okay. And was that since you were 18? Or how long would that have been?
Yeah, probably early 20s.
Yeah.
But it was never anything a regular thing. It was just an occasional.
So an occasional thing, just so again, once every couple of weeks. Thank you for sharing that with me. Now I just need to look into your family, if that's okay.
Yeah.
Can I ask your parents, are there any conditions around the family?
My auntie on my dad's side had kidney transplants and died of renal failure, so that's the only family link. And my auntie on my dad's side, she has problems with high blood pressure and things like that. So that's the only link. On my mum's side, they're all pretty healthy.
So your parents didn't have any, or haven't had any conditions?
My mum died of a chronic leukemia.
Sorry.
That was last year. And because my parents divorced a long time ago, I'm not quite sure what my dad died of, but
That's fine.
it's likely he lived or something, because he was a bit of a drinker.
Okay. And do you have any siblings?
Yeah, I've got 3 sisters, two older and 1 younger. As my elder sister gave me the kidney.
Oh, okay. And otherwise, are they all well?
My sister's got non-Hodgkin's lymphoma, but she's in my youngest one, but she's in remission, and the other 2 are reasonably fine.
Okay, that's good to hear. And then, do you have any children?
Yeah, I've got 3, and they're all well.
3 or well?
My youngest daughter had some problems with insulin resistance, and that 4 years ago, saw an endocrinologist, but that's all settled down. And the other 2 are all pretty healthy.
Now, I just want to look into, I guess, your lifestyle at home. How would you describe your diet?
Pretty balanced. I don't eat too much, shitty, junky sort of stuff. I tend to do most of the cooking. We just pretty much cook fresh sort of stuff and things like that. Occasionally we might have pizzas and things like that, but we don't eat a lot of processed, junky stuff.
That's good. Do you exercise?
Not at the moment. So I've had problems. I was a little bit anemic for a while, and things dropped off. So I haven't been doing much in the last 3 months. But prior to that, I'd be running and training and playing hockey over summer and things like that. So.
And just with that anemia, have you had problems with anemia?
Yeah, because it's my sister's kidney. For a while, I had problems with anemia. I was on just the synthetic EPO injections for a while, but that seems to. I'm not on them anymore.
Okay. And I just want to know, have you been travelled anywhere recently?
No, I haven't. We haven't been anywhere.
And can I ask, what do you do for a living?
I'm a nurse.
Yes.
Mental health.
Okay. Whereabouts?
I work in a children's mental health program just over in Shenton Park.
Okay. And has there been any stresses at home recently? Or anything causing stress?
No. I'm probably less stressed because I'm only working 3 days a week now. So.
Oh, okay. That's good. An extra time to get your feet up. Now,
well, I look after my grandson on one of those days. So.
Oh, okay. I just want to ask as well, is there anything that, I guess, has happened since you've come to hospital? Any complications that have occurred?
No.
No? So, you said you're originally in Joondalup.
Yeah.
What made you be here?
I was in Joondalup on a Friday, and then over the weekend I just got worse again. And then when I saw my GP on Monday, he sent me off for some blood tests and a stool sample. But then I rang up and spoke to my renal specialist that afternoon. He said, "Come in here."
Okay.
Excuse me, Jeff. 2 more minutes.
Okay, sure. So, just to confirm, so when you were in Joondalup, then they just gave you fluids and discharged you?
Yeah.
Okay. And then you felt worse over the weekend?
Yeah, I think I just got dehydrated again.
Okay. Now, just lastly, just want to I guess summarise back to you, just make sure there's nothing missed here. So you came in originally with a diarrhea that lasted for 13 days.
Yeah.
From when it originally started. You believe the moment you got it from your grandson who was sick when he saw you. You had some vomiting and nausea and diarrhea that happened probably around 12 times per day to the toilet.
Yeah, something
around there. And then you had some what you believe was dehydration causing fainting and some numbing.
Yeah.
You didn't have any associated pain. There was no blood, no fever. It didn't improve with fasting, and but when you stood up, you felt wobbly.
Yeah.
Excellent. And just previously, you've had a kidney transplant, and you have had some anemia previously, and you have been diagnosed with sleep apnea.
Yeah.
Excellent. Is there anything else that you think needs to be
No, I think that's pretty much it.
That's pretty much it. Excellent. Now, is there anything you're particularly hoping, concerned about in terms of?
Well, I'd just like to get the diarrhea knocked off. Just because the longer it goes, the more I get concerned about it. So that's the main thing, really.
Excuse me, Jack. I'm going to call the history part to a close. And would you like to do an examination for 10 minutes?
Yeah, certainly. So just like to do a gastrointestinal examination.
Right.
Okay. So,
Thanks, Jack. Would you like to present your case today?
sure. So today I went and did a history and examination of William James. He's a 62-year-old nurse from a mental health unit. He's presented with a 13-day history of diarrhea with associated vomiting, nausea, and fainting, which started 8 days afterwards. He previously went to General Hospital with this complaint, where he was given rehydration fluids, then left, and then discharged. However, it was then reappeared, and he was brought to the jail guns. Some important points to make is that he had no blood in his stool, despite and had no fever. He also was no better with fasting, and with the periods of feeling faint, he had no loss of consciousness. He reports there was a foul smell in his diarrhea, and he was going approximately a dozen times a day. William James's background is that he has previously had a kidney transplant 5 years ago, and he was previously diagnosed with sleep apnea. He's on a variety of medications for, in particular, prednisolone. He's on antihypertensives, anticoagulants, a pro-gout, and a magnesium supplement. He has no allergies. He's fully vaccinated and to bowel screenings. He has previously used cannabis, has smoked socially in Germany, and has a insignificant alcohol history with a social background of 2 to 4 drinks per week. Some important family history is that his sister has, his paternal auntie also had a renal transplant, and his family has a background of leukemia. He lives at home with his 3 children and hasn't travelled recently. With William's condition, through the examination findings, I found there was no signs of acanomegaly. However, I did see some distension in the abdomen region with some potential ascites. And
Sorry, would you like to just run through your examination findings in full?
Oh, in full, sure. In the periphery, there was no signs of any abnormalities. His hands appeared. In his hands there was some pallor in the palm creases that was found. Otherwise, in the face, there was no normal findings. His supraclavicular nodes were not palpable. There was no signs of gynecomastia or spina nevi. There was also no asterisks in the arms. in his abdomen there was a cited a scar in the right iliac fossa, and then also in the abdomen there was no pain or tenderness on palpation. He showed no signs of academically, as I said previously. Murphy's sign was negative, Castell's sign was negative, and there was bowel sounds present and no aortic bleeds. My differential diagnosis with all this taken into account would be firstly a differential of gastroenteritis, a subacute case. This would be due to the fact of this vomiting and nausea, as well as the diarrhea with the frequency. This, however, would probably be less likely with the fact that there was no fever. It would be more likely if there was fever showing infection, it is, and also the fact that there was no blood in the stool showing inflammatory diarrhea. Another differential I had was potentially pancreatitis causing gastric obstruction, where because he did report that on large meals he would then be caused to vomit. This could, and pancreatitis can show some gastric outlet obstruction. It would then also explain the foul smell in his diarrhea by the lack of fat and nutrient absorption with pancreatic enzymes. However, and I guess some investigations I want to do to confirm any of these diagnoses is firstly I want to look at his stool, do a fecal culture, see if there was any bacteria in the stool, for inflammatory markers, a fecal calprotectin, to see if there was inflammatory diarrhea that he was having, and then also some fecal elastase to see if there was any signs of any pancreatic dysfunction, and then an abdominal ultrasound for imaging to see if there was any distension or blockage of structures.
Okay, very good. So why don't we just delve into the presenting complaint in a little more detail. So predominant symptoms seem to be diarrhea, up to 12 times a day you mentioned. And of that you're wondering about infection as your number one differential. Does he have any risk factors for infection?
He does, in the fact that he's on prednisolone, which would be a immune suppressor, and then also the fact that he has had a kidney transplant. That would be a risk factor increase for infection with the need to suppress, prevent. Sorry, I forget the word. Rejection of the transplant. However, that was 5 years ago. So.
Sure. Any other risk factors that you might think about for infectious diarrhea?
The fact that he was around I should have mentioned his young granddaughter. He did mention that when he saw her, she was ill, and his wife also became ill within a day. And then later, I guess the site that he was around infection or acute signs of gastrointestinal problems would further that.
Do you know of any other risk factors for infectious diarrhea?
Infectious diarrhea.
Is there any medications, for example, that may change the gut microbiome?
I know, not with the ones he was taking.
Yep. No troubles. And do you think he had severe diarrhea, or do you think this is mild? Or how would you sort of classify the severity of his presentation?
I'd say it was. I'd say it wasn't over. I'd say probably moderate. I wouldn't say hugely severe. It was a large amount of times he was going to the toilet. It did wake him up at night, so I didn't mention that. But the fact that he was still eating between going to the bathroom, he said he was eating quite large amounts. He was feeling nauseous, but he wasn't feeling, I guess, completely stopping. And the fact that it lasted so long, to 13 days, would kind of also imply to me that if it was incredibly severe, he would have presented a bit earlier. and the fact that there was no fever or blood.
Why was he getting pre-syncopal?
That would have been due to the fact of the volume loss and standing hypovolemia could potentially cause.
So is there any other symptoms or regarding hypovolemia or dehydration that you would ask about? No?
So I'd ask about if he had a dry mouth, if he felt like his heart rate was a bit faster, potentially if there was any more signs of confusion, or if his skin tone, like his skin felt tighter.
Sure, and someone that's had kidney problems in the past.
Urine output.
Yeah, urine output, great. And the corollary of that on examination, what would you be looking for to assess severity of dehydration in this man?
I'd be looking for his skin turgor, his blood pressure potentially. Also be looking at his heart rate and his I guess the moisture in his submucosal, mucosal lines.
Terrific, and his postural blood pressure.
Yes.
Useful as well. You mentioned you had a kidney transplant. Do you know any of the details around that? Why you had the kidney transplant?
No, I didn't go into that.
And has he had complications after that?
I did. I believe he hasn't had any complications apart from the anemia. He did say he had some signs of anemia after the kidney transplant, but he was using erythropoietin injections. However, that has ceased and cleared up.
So, you mentioned he's on immune suppression, which is a risk factor for infection. Do you know, is this the only time he's had infection, or has he had recurrent infections related to his immune suppression previously?
He has previously had a viral infection, which he did come to hospital for in 2019, where he had, that was a bit upset, yes.
Yeah. Okay. Let's just go into your differentials. You mentioned gastroenteritis as the prime number one differential, which I think is very reasonable. And then pancreatitis as a second differential. And you mentioned some reasons why pancreatitis may be in your differential diagnosis. What would be against that as a diagnosis?
I guess the timeline would be against it. From my understanding, acute pancreatitis is very fast as well, and then he also hasn't had any signs of any hypoglycemic instances, which would show, I guess, lack of insulin being produced. So that would go against that.
What's when people have an acutely inflamed pancreas gland, what's the predominant symptom of that?
Oh, pain right into the back. So you don't have that here.
That's right. Okay, well that's very good, Jeff. Thank you for your time today. The next part will be the feedback session.
Thank you.